Well, hey everybody. I'm here with Tony and Gena. Tony and Gena are part of our church family, and this is part of our Frontline series where we're interviewing those who are on the front lines during the COVID-19 pandemic. Tony and Gena, why don't you introduce yourself and tell us where you work and what you do?
I'm Gena. I'm a pediatric nurse. I work at St. Francis Children's Hospital, and I've been a nurse for 18 years now.
Wow.
Yeah, that's awesome.
Yes.
What about you, Tony?
Yes, I'm Tony, and I'm an ICU nurse at St. John Medical Center, the main. I think I've been a nurse for maybe 7.5, something like that.
Okay. So several years of experience between the two of you, right?
That's you.
Now, Gena, you said pediatric nurse. Do you work with a certain age group of children, or is it any age, just depending on where your shift is?
Yeah, preemie to normally 18. There's a
Oh,
few that we get that are older than that, but
okay. So how has your jobs changed since COVID-19 began?
my job hasn't changed a whole lot. There's just not as large of a COVID population in the pediatrics.
Mhm.
Mainly, it's just additional guidelines. So safety precautions, visitation is a whole lot different. There's not as many people coming in and out. And we do wear a mask our entire shift.
Mm-hmm.
So really it's just trying to keep up with all the new rules for that week.
Mm-hmm. What is visitation like? What's allowed? What's not allowed?
So right now it's both parents are allowed to stay, no other additional people, no children or siblings in the hospital whatsoever. So the parents can stay, but if they have to leave to go home, they have to wait until the following day to come back. So they're trying to eliminate all the back and forth and possibly carrying something into the hospital.
Yeah. What about you, Tony? How has your job changed?
Yeah, as for us, early on, it was there were changes like every other day, just going on by what the CDC had to say as well as our local government. So just protocols have been um, kind of changed a little bit as far as at first it started out, we knew that there was going to be a shortage on some of our resources, just going on by what the rest of the nation had to say, with the hospital facilities. We've been just trying to be resourceful. As far as visitors, we shortened that early on, but now there's like no visitors at all. As well as us, whenever we come into the hospital, we have to answer a few questions. Have we had any coughing? Have we felt have we had a fever or anything like that? And at which point we would not be able to enter into the building. So there's a checkpoint, which kind of delays time, but it's necessary, as well as wearing masks uh, inside at all times, whether you actually have a COVID positive patient or not.
We also have to check in and have our temperatures taken before we start our shift, as well as all the parents that come in, we check them also.
Uh-huh. So have the amount of people who are not COVID patients coming to the hospital, has that decreased or increased, or is it the same?
No, it's decreased with the shutdown. And then the information that everyone's getting over the news, so everyone is fearful and reluctant on coming in for just minor things. Looking at, because mainly it kind of it funnels in from the emergency department. And, then it goes into the facility. But early on, we seen, whoa, there's, barely anyone in the emergency department. So that's going to mean less influx of new patients.
Mm-hmm.
And then whenever um, they they put on hold of the what am I thinking of? The elective surgeries and
Right.
whatnot. Yeah. So that put a shortage. So our census is pretty low. But now that they're starting to open things up, we know there's at one point it's going to get to probably be overwhelming. I would say with new patients coming in once the bans are lifted. Plus, you have those patients that are staying home and when they probably should have came in, so they're actually getting more severely ill, and then they come in and it's a lot more serious than it would have been.
People are fearful to come into the emergency room unless they really need it. It's like pediatric patients, we used to have 200 come through like in a 24-hour period. Now we have like 40 to 60.
Wow.
So it's dramatically decreased.
Hmm.
We have closed one floor and the others are sometimes half full. So
Mm-hmm. So have your shifts decreased as well, like the amount of time that you've been working?
yes.
Hmm.
Yeah, Tony used to work 4 shifts a week, most weeks, and he's been working 2 to 3, depending on if they need him.
Right.
I think what they've done they've managed it, I'd say, pretty well. In with the amount of patients that we have, so you still have to justify the amount of nurses that are there. But what they've done is they've basically cut it back to where no one can work over their normal full-time hours, which is like 36 hours a week, which is 3 shifts a week, which is good because prior to this COVID, you could work as many days as you wanted to work, which for me, it would be normally like 3, 4 is stretching it, but 3 a week was fine. But in our regards, it hasn't really been a shortage for us. But then you have to look at, the rest of the hospital is as far as like the recovery nurses, after surgeries. We're still having surgeries. We're just not having the elective surgeries. However, I think they just opened that up last week. We're going to start having elective surgeries. But, you would just have a lot of nurses that are, their hours would have been cut back significantly.
Mm-hmm. Yeah.
Also,
So what?
people home, sometimes 20, 25 nurses a shift, but they're trying to rotate it around so no one gets sent home all the time.
Right. So what about COVID-19, based on your experience or the information you're receiving? There's all kinds of information out there from all the different sources. And if people watch too much news, they could be overwhelmed with fear, or they could even be underwhelmed, and so to speak, and say, well, this is no big deal, depending on which news station you watch. So what do we need to know about COVID-19 that will help to keep us safe as well as help to combat the virus?
Just basically, pretty much what the CDC says, just, keep your distance. Especially if, someone is, if they're coughing, and if you're one that, is kind of under the weather and coughing, you want to, be mindful of that and keep your distance from anyone. But, it's like a droplet, basically. So there's, I know they've done the studies on the distancing and everything, but you're only under, Well, basically, you only can really get it if someone is actively coughing on you and they're within close proximity to you.
Mm-hmm.
So wearing the mask, which we see that everyone's wearing the mask out. Some people are wearing gloves out there, just not to get, anything on their hands, which then their hands leads to their eyes and mouth and
Mm-hmm.
everything like that.
Mm-hmm.
And then washing your hands. That's the biggest thing, how to stay away from it, I would say.
Yeah, just
Yeah.
be smart, be cautious, but don't be fearful. Follow the CDC or the WHO more than you trust the news, because they're the ones actually doing the research.
Yeah.
Mm-hmm. Yeah. So, how can we at Bethany Church pray for you guys, your family, but also your coworkers and your fellow nurses?
I would say, I mean, we always need prayers, um, but just allowing these people that have been affected by, and we've all been affected, um, but those that uh, you know, uh, have come down with it, or a family member of those that have come down with it, just to pray for them, to give them comfort. And if they don't know who Jesus is and what he did for us, give them another opportunity
Yeah.
that they can hear about him. And also all those that may not have been directly affected by it, um, but the others that have, lost their jobs. And that's where my heart really goes out to, because it's, someone said it, I was listening to the radio, it's almost like the cure is worse than the actual virus itself. And
Yeah.
meaning that, with like our economic system and everything, because it's very real for some people that may not have gotten sick from it, but they've lost their jobs or they've been furloughed for, all of this time. So there's definitely a direct impact on that.
Yeah.
There's a lot of prayers going up for nurses and doctors, and we do appreciate that. Not to forget all the other workers in the hospitals. You have housekeepers, cafeteria workers. It just goes on and on.
Right.
And my prayer at the beginning, more so than now, was that we would stay healthy. Because if either one of us get healthy, that means we're both at home. And there's a
Get
lot
sick.
of,
Right.
get sick. So there's a lot of nurses that are couples too, that both of their incomes would be affected in that
Right.
way. Psychologically, there's going to be a lot of nurses that are dealing with multiple deaths. We are trained to handle that, but at this enormous number, it's still a lot. And so I think there's going to be some nurses that might have
Yeah.
some PTSD,
Yeah.
that might even quit their job because of it.
Yeah.
So the future of nursing, I think, is we'll have to wait and see how
Yeah.
many drop off after this.
And I will say that like in my department and everything, we're actively, we're taking care of positive, patients, and that are severe, and it hits their respiratory system, and so then they're intubated, and I mean, it's very real, and so that's another concern of mine, just like she was saying, is that emotional, um, toll,
Yeah.
because I know when, for me, it, we wouldn't have the amount of mortality rate that we're having now with this illness, but it would kind of take a toll on you, because it's just, it's death, and you want to be around life and everything. That's what God created us for. But now it's just to a higher limit. Especially one of our ICUs, it was a strictly COVID patient, the severely ill. So we would have a chaplain. He would be sitting outside of the unit. So any of the nurses that came in and any of the nurses that were leaving, he would be there for them, if they wanted to, just kind of vent out a
Mhm.
little bit or have prayer, but he was always there as a smiling face, basically, just someone that's there for you and to comfort you.
Yeah. Yeah, I can imagine the weight of experiencing death in that way, as well as just understanding the severity of this disease and your responsibility to care for the patients can be heavy. And so we will be praying with you guys for Tony and Gina specifically, but also for other healthcare professionals. As Gina mentioned, the other workers in the hospital, lots of different aspects of hospital that keep it running, even the maintenance crew, technicians, all of these people. So we'll be praying for those. And I want to say thank you to from our church to you guys for what you do, and we're thankful that you're a part of our church family, and we will continue to pray for you. Thanks for what you do for our community.
Thank you.
Thank you.